first guest tonight is Nicole Archer, who is a nurse practitioner with Neurosurgical Associates, and neurointervention is what you do a lot.
Yes, sir. Thank you.
Now, we talk about stroke, and some people get heart attack and stroke convinced. Heart attacks of the heart, but stroke is of the brain. Tell us what happens and some of the symptoms that occur.
So a stroke is when a clot forms and goes into the brain, or the artery may rupture, causing the patient to present with loss of speech, which we call aphasia, or a loss of movement of one side of the body or the other, facial drooping, or even confusion at times. It's the 5th leading cause of death in the United States and the #1 leading cause of disability.
Okay, so it's something that's preventable and treatable, and are there warning signs that okay, maybe something's going on here?
So patients will have TIAs, which may be warning signs for the patient.
Now, TIA, what's that stand for?
Trans-ischemic attack.
Okay.
Which may be small strokes. You may hear people refer to them as mini strokes. And those are precursors usually to a larger stroke that may occur.
What kind of symptoms might a TIA show?
So a TIA might show with slurred speech that lasts for as little as a few minutes to 30 minutes or an hour. They may also have numbness or weakness in an arm, a leg, or confusion that they just don't seem right to their family members or their loved ones.
Okay. Now, who's at risk for a stroke? Are there certain risk factors that may lead you to think that you're a possibility that could happen to you?
So risk factors for stroke are diet, poor diet, atrial fibrillation, high cholesterol, hypertension. All of those are risk factors, as well as age, gender, and ethnicity. Those play a part in what your risk factors are for stroke.
Diabetes are big, especially in Kentucky.
Yes.
All right, now, you talked about what a stroke is. Treatment, you don't need to ignore certain symptoms because this time is important.
Yes, so time is important, and the window for stroke to receive the drug, what we call alteplase or TPA, is 3.5 to 4.5 hours from time of onset of symptoms. And that's as long as you get to the appropriate facility for the appropriate treatment.
Now, the TPA is a clot buster. Am I using the right term?
That's the right term, yes, sir. So it eats through the clot is the best way to describe that, and helps assist us in restoring vasculature to the patient, blood flow to that area of the brain.
So if you're having a symptom, weakness, loss of speech, that, man, this might be stroke, you don't want to wait 2 or 3 hours to see if it goes away because you might lose your window of opportunity for treatment.
No, we want you to go to the nearest emergency room for the best possible care, and we use FAST, face, arm, speech, and time.
Are all strokes clots? Are there other different types of strokes?
No, there are different types of strokes. There are ischemic strokes, which are clots, and hemorrhagic, which are ruptures of the vessel. And those are what other people refer to as bleeds into the brain.
Okay, and there's the clot buster, but there's also, like when you go up in the heart to remove a clot, you can also go up into the brain.
Yes, so we actually do mechanical thrombectomy, and that's where you go into the brain with a retrieval device. We use a stent retrieval device to go in and pull the clot out, and that also restores flow into the blood, into the brain. And
restoring flow can prevent you from having persistent defects.
Yes, sir.
All right. That's great information. Now let's watch this healthcare talk brought to you by Baptist Health about stroke summary.
A stroke is typically thought of when there's a blockage to the blood vessels to the brain so that the brain is not getting blood flow and not getting oxygen. When someone's having a stroke, it's very important to seek care as soon as you possibly can. There is an acronym that we use that's FAST, facial drooping, arm or leg weakness, speech difficulties, and time, to emphasize that it's important if you have any of those symptoms to seek treatment as soon as possible, because a lot of the treatments that we have are very time dependent. For example, the clot busting medicine, TPA, that we like to administer, we have to give that within 4.5 hours of symptom onset. But then we also have newer procedures that are interventions like you might have if you were having a heart attack. For someone that's having a stroke, we're now able to physically go in through the blood vessel in the leg and remove the blood clot from the brain by going in a minimally invasive way like a cardiologist would. So a comprehensive stroke center is a distinction we're very proud of. There are less than 200 comprehensive stroke centers in the U.S. Baptist Health Lexington has been very committed to stroke care and staying really at the cutting edge. We're able to offer the best care available in the world for strokes and for stroke therapy, and offer that on a 24/7, 365-day-a-year basis.